Peripheral arterial disease, PAD, is a prevalent yet often underdiagnosed condition that affects the arteries outside of the heart and brain. PAD develops when the arteries supplying blood to the limbs, particularly the legs, become narrowed or blocked due to plaque buildup, a process called atherosclerosis. This reduction in blood flow can lead to a variety of complications, from pain and discomfort to severe risks such as heart attack, stroke, and even limb amputation. What causes peripheral arterial disease? High blood pressure, hypertension. Chronic high blood pressure damages the arterial walls, making them more prone to plaque buildup. High cholesterol. Elevated cholesterol levels, particularly LDL bad cholesterol, increase the risk of atherosclerosis. Smoking. Smoking is one of the most significant risk factors for PAD, as it accelerates artery damage and reduces circulation. Diabetes. People with diabetes are more likely to develop PAD due to the adverse effects of high blood sugar on blood vessels. Age. PAD becomes more common as people age, especially after 50 years old. Family history. Genetics also play a role. Having a family history of PAD or heart disease increases risk. Sedentary lifestyle. Lack of physical activity contributes to risk factors such as obesity and high blood pressure. Recognizing the symptoms of PAD. Leg pain or cramping claudication. Pain, cramping, or fatigue in the legs or hips during physical activity, such as walking, which subsides with rest. Numbness or weakness. A feeling of weakness or numbness in the affected limbs due to reduced blood flow. Cold skin on the legs or feet. A noticeable coldness in the skin, particularly on the lower limbs. Wounds or ulcers that don't heal. Slow healing wounds or ulcers, especially on the feet or legs, due to poor circulation. Shiny or smooth skin on the legs. The skin may become shiny, pale, and smooth as a result of reduced blood supply. Hair loss on the legs. Reduced circulation can result in slower hair growth or hair loss on the lower limbs. Weak or absent pulse in the legs or feet. In severe cases, a weak or absent pulse may be detectable in the affected leg or foot. How is peripheral artery disease diagnosed? Ankle brachial index, ABI. One of the first steps in diagnosing PAD is the ABI test, which compares the blood pressure at the ankle with that of the arm. A lower ABI score suggests the presence of PAD. Doppler ultrasound. A non-invasive imaging test that helps visualize blood flow and detect areas of narrowing or blockages in the arteries. CT or MRI angiography. These imaging techniques offer a detailed view of the arteries, helping Dr. Anwar identify blockages or other vascular issues. Comprehensive medical history and physical examination. Dr. Anwar takes a holistic approach to diagnosis, considering lifestyle factors, medical history, and the patient's symptoms to develop an accurate diagnosis. Treatment options for PAD at the Leg Pain Clinic. Lifestyle modifications. Smoking cessation. Exercise. Healthy diet. Weight management. Medications. Antiplatelet drugs. Cholesterol-lowering drugs. Blood pressure medications. Endovascular treatments for PAD. Dr. Bilal Anwar is a leader in endovascular procedures, which are minimally invasive techniques that use catheters to treat blocked arteries. These treatments are performed through small incisions, allowing for faster recovery times compared to traditional surgery. The most common endovascular treatments for PAD include angioplasty. In this procedure, a balloon is inserted into the narrowed artery and inflated to widen it, improving blood flow. Stent placement. After angioplasty, a stent, a small mesh tube, may be inserted to help keep the artery open and prevent renarrowing. Atherectomy. This procedure involves removing the plaque buildup from the artery walls using a catheter with a rotating blade or laser. Schedule a consultation with Dr. Bilal Anwar today at the Leg Pain Clinic. Your legs carry you through life. Take care of them.